And then over here I have my provider's orders and my MAR as well. And then I have my lab, my drug cards, my labs on the back. And Jackson, okay. And then Brinley will be videoing for me. Okay. Gather all my supplies. I have my pill cutter, my cups, my water cups, my orders, my cart, my medications. All right, I'm gonna go ahead and enter my patient's room. Hi, my name's Martha. I'm gonna be your nursing student today. I'm gonna go ahead and close this curtain for privacy. Could you go ahead and verify your name and date of birth?
Joseph Smith, 1095-1954.
Perfect. I'm gonna check your wristband. All looks good. I'm gonna go ahead and perform hand hygiene. Joseph, do you have any allergies?
Nope.
Okay. And then I would wear PPE if necessary. I do not need to do that today, but I will be wearing gloves when I am administering your medication. Okay. So today we will be doing medication administration. I have checked my provider's orders. And then I'm just gonna go out to my med card. And just to confirm, what's your pain level today, from a 0 being no pain to a 10 being lots of pain?
0.
0, okay. And then how would you like to take your medication?
Orally with water.
Orally with water? Okay, that sounds great. All right, I'm going to go out to my medication cart and start that. And are you comfortable?
Yep.
All right, perfect. I'll be back in shortly. All right. Out at my med cart, I have my drug cards and my provider's orders. So I'm going to go ahead and I'm going to verify my provider's orders with my MAR. All right, so we have Joseph Smith, date of birth 10/05/1954. I have digoxin lanoxin 0.125 milligrams by mouth daily for congestive heart failure, atrial fibrillation, and it is active. I have for Joseph Smith, date of birth 10/05/1954, digoxin lanoxin 0.125 milligrams by mouth daily for congestive heart failure and atrial fibrillation. It is not given yet, so I can't administer it. Okay, and then I have furosemide Lasix 40 milligrams by mouth BID for congestive heart failure, and it is active for Joseph Smith, and his date of birth is 10/05/1954. I have for Joseph Smith, date of birth 10/05/1954, furosemide Lasix 40 milligrams by mouth daily for congestive heart failure, and it is not given yet, so I can give it. And then warfarin Coumadin, I have 5 milligrams by mouth daily for congestive heart or atrial fibrillation, and it is active. And for Joseph Smith, date of birth 10/05/1954, I have warfarin Coumadin 5 milligrams by mouth daily for atrial fibrillation, and it is not given, so I am able to give that. Okay, so my provider's orders and my MAR look good, so I'm going to go ahead and put away my provider's orders and just pay attention to my MAR. At this point, I'm going to go through my drug cards and go through my labs and go through the assessments as well. So for digoxin lanoxin, nursing considerations are: I would assess the apical pulse for 1 minute, monitor their electrolytes, monitor their ECG, and monitor the resolution for atrial dysrhythmias by the ECG. And then for their digoxin level, it was a 2.1. The range should be between a 0.8 and a 2. Their range, or their level, was out of range, so I cannot give digoxin. Furosemide Lasix, their nursing considerations were HF, assess fluid volume status, and then hypertension, assess BP, blood pressure, and then ototoxicity, assess for hearing loss, and hypokalemia, which I should assess for acidic urine. And then their potassium level was a 3.3, and it should be between a 3.5 and a 5.0. Their sodium was a 133, and it should be between a 135 and a 145. And then their creatine was a 1.2, and it should be between a 0.5 and a 1.1. All their levels were out of range, so I am unable to administer furosemide. And then I asked the patient if they were in any pain, and they said they were not, so I will not be giving them oxycodone, acetaminophen, and then Perrico. Because they are not in any pain, it is not necessary for them to have today. But nursing considerations for oxycodone would be assess their pain, their CNS changes, assess for allergic reactions, and assess for respiratory dysfunction if I were to give it. But again, I am not giving oxycodone. And then the action of oxycodone would be inhibit ascending pain pathways in the central nervous system, and it increases pain threshold and alerts pain perception. But again, I am not giving that. Warfarin Coumadin, the nursing considerations are monitor blood studies, assess for bleeding, monitor their blood pressure, and assess for fever. The labs for warfarin Coumadin were the INR was a 2.6, and it needs to be between a 2 and a 3 to be able to administer. So warfarin Coumadin is the only medication that I am able to administer today. All right. So then I'm going to go ahead and I'm going to start my first medication check today. So I'm going to go ahead and in my drawer, I'm going to pull out warfarin Coumadin. All right. So I'm going to check my drug with the MAR. So I have for Joseph Smith, date of birth 10/05/1954. I have Joseph Smith 10/05/1954. I have warfarin Coumadin 5 milligrams by mouth daily for atrial fibrillation. I have warfarin Coumadin 5 milligrams for atrial fibrillation, and it has not been given yet. And the integrity of the package looks good, and the expiration date is 04/2041, so that is good. And then again, it has not been given yet, so I am able to give this. So I'm going to go ahead and I'm going to place it in my medication cup. And I'm going to place it on my med tray, and then I'm going to go ahead and I'm going to perform my second check. So from my med cup, I have, and I'm going to compare it to my MAR, I have Joseph Smith, date of birth 10/05/1954. And then in my cup, I have Joseph Smith 10/05/1954. So I have warfarin Coumadin 5 milligrams by mouth daily for atrial fibrillation. In my med cup, I have warfarin Coumadin 5 milligrams. It's for atrial fibrillation, and it's a tablet, so you can take it orally. And then the expiration date is good, and so is integrity of the packaging, no rips or tears. And also, at this point, I would be sure that if I needed to cut my meds or but I do not need to today, as I have the amount listed on my MAR. So I am all set for that. All right, then I'm going to go ahead and I'm going to go into my patient's room and perform my third check at bedside. Hi, my name's Martha. I'm going to be your nursing student today. I'm just going to go ahead and perform hand hygiene. I'm going to close the curtain for privacy. Could you go ahead and tell me your name and date of birth?
Joseph Smith, 10/05/1954.
Alright, I'm going to verify your wristband. All looks good. Do you have any allergies?
Nope.
Okay. And then are you in a comfortable position?
Yes.
And you stated before that you like taking your medication orally. Is
Yes.
that correct? Okay, perfect. And then I'm just going to go ahead and I will be administering warfarin Coumadin for you today. I'm going to go ahead and educate you about it a little bit. So the action of warfarin Coumadin, it interferes with blood clotting by indirect means. It depresses hepatic synthesis of vitamin K dependent coagulation factors. And then some adverse effects and side effects of warfarin Coumadin are nausea, cramps, fever, rash, vomiting, and diarrhea. And then would you be able to just go over and tell me the side effects of that again?
Nausea, rash, fever, diarrhea, bleeding.
Okay, yep, awesome. Perfect. Okay, and then your INR was in range, so I am able to give you this medication for today. So then I'm going to go ahead and I'm going to put on my gloves. Grab some gloves over here. Okay. Perfect. And then before I give you this medication, I want to be sure to scan it in. So I'm going to go ahead and first perform my third check before I do that. So I have Joseph Smith, date of birth 10/05/1954. Joseph Smith, 10/05/1954. I have warfarin Coumadin, 5 milligrams, 5 milligrams, daily from PO, and you're taking it orally by mouth for atrial fibrillation and for atrial fibrillation. The expiration date is 04/2041 on the packaging, and the integrity of the packaging is good. I do not see any rips or tears, so I am able to administer it. I will then put in my medication cup. And then, would you like to still receive this medication?
Yes.
Okay, perfect. So I have my water cup and the med cup. And so I'm going to go ahead and hand you the water cup, and here's your medication. And I will stay with my patient as they take their medication to make sure that they have taken it. Okay? Perfect. And then I will go ahead and document, according to sound nursing judgment, the medications that I have administered and have not administered. And then I'm going to go ahead and sign off on my paper. Just going to find my pen. There it is. All right. So warfarin Coumadin was the only medication that I gave today. So I'm going to go ahead and check it off. And I gave it at 10:30, which is in the correct time. So I'm going to go down to warfarin Coumadin, and I'm going to sign my name. And then since I have not given digoxin, furosemide, or oxycodone, I will not be giving those medications today. So I will not be signing off on them. But I'm going to sign my name and then the time. Okay, so that all looks good. And then I'm going to go ahead and I'm going to ask my patient if there is anything else I can do for you. I have time.
Nope.
Okay, perfect. And then I'm going to go ahead and take off my gloves. And then I'm going to go ahead and make sure that the bed is lowered. It's locked and secure. The side rails are in place. You have your call light. You have the table. Your room is clear from any risks and falls. And then I'm going to go ahead and I'm going to clean up my provider's orders and put everything back as I have found it. There we go. And then if there were adverse effects usually begin within 30 minutes of the patient taking the medication. So then I would go ahead, and if adverse effects were to happen, I would first make sure to withhold any further doses, assess their vital signs, tell the provider, and then tell the pharmacist. And then I would go ahead and document according to agency policy. And then I would go up and clean all my supplies, and then I would go ahead and perform hand hygiene. And then the 5 moments of hand hygiene are before touching a patient, before touching a patient's surroundings, before an aseptic procedure, and then after touching a patient and after touching a patient's surrounding. And then I would submit my video and my drug cards to Schoology.